Hello, good afternoon. This is Dr. Scantberry, and I am going to be hosting this discussion on this afternoon. And so we are waiting for two guests to join. So please hang on while I invite my guests in to this room. So good afternoon, Andrew. Nice to see you.
Good to see you as well.
And hopefully we will have Kiana Bishop joining with us. And I think she is here. And I will go ahead and invite her into the room so that we're ready to go as soon as she is able to get that link uh, and settle in. We're a few minutes before 12:30, and I see many of you have already joined the program. And thank you so much for being here early. Again, my name is Dr. Scantberry, and I am here this afternoon with a very important session on phosphorus and phosphorus metabolism. I know for many of you on dialysis, that's very important. And I know if you have questions, please go ahead and place them in the chat while we wait for our other guests to join and to log on. It looks like she is not able to join. I'm going to try to click the link again to allow her to be able to join us. Oh, there she is.
Good afternoon.
Good afternoon. How are you?
I'm well. How's everyone?
Thank you. Thank you. Thank you so much for joining us a little early so that we can allow our guests to come in and for us to be able to have this discussion on phosphorus. So I know it's hot outside. I know it's hot here. So I'm not sure where you two are,
I'm
but I certainly
in
hope that.
Michigan and it's warm.
Where are you?
Michigan, Detroit.
Michigan. Okay.
Yeah.
And Andrew, where are you?
I am in Alabama, so it's
Oh,
absolutely hot.
you are definitely in the hot zone. We generally don't have it as hot but it's now really baking here for us. And I think yesterday it was still 95 degrees at 6 o'clock in the evening. So we're definitely we're roasting, and this
Yeah.
is quite unusual. So for those who don't believe in climate change, there's certainly a lot of strange things happening that we can't explain. But thank you for being here, and I hope we can have quite a excellent, robust discussion on this topic. And we will. I think we have one more minute, and then we'll go ahead and get started so that folks can. They're probably waiting for the 12:30 start time, so we'll give everybody another minute or so before we get started. So make sure you have your water or something to drink, a sip on during this session. So it should be robust, and we already have 17 people already logged on, so this should be exciting. So any questions before we start?
No, I'm just ready to answer questions or tell my story. Either way.
Okay, awesome, awesome. Wonderful. Should be, hopefully, I encourage everyone who is on the call. Uh, be sure to put your questions in the chat box so we can see your questions. Because this is a special session and we have two guests, so we will not be taking any other invitations to join live, but we will take your questions and hopefully we'll be able to get to your questions. I'll try to keep track. And I know Nancy will help also. So Welcome, everyone. It's 12:30, and this is Dialysis Patient Citizens Educational Session coming to you live here this afternoon. And with us, I'm Dr. Scandaberry, and we are definitely having a brisk conversation. And we have Andrew Conklin, who is president of the board of directors of Dialysis Patient Citizens. And we have Kiana Bishop, who is also a board member. And both of my guests have vast experience with phosphorus issues, having have been on dialysis for many years. So thank you very much for being here. We know that phosphorus issues is one of the main issues that we monitor patients for on dialysis because it becomes crucial to control your phosphorus. And we know many foods contain phosphorus, and the standard for many patients is really about limiting those foods that are high in phosphorus and also taking the binders. And we know that conventionally, binders are the way that we treat our patients, but with the use of binders to actually bind that phosphorus that you take in. So it really is about limiting those foods because every time you eat those foods that are high in phosphorus, the goal is that your phosphorus levels will rise because you are unable because of kidney disease, and your kidneys are the ones who process your phosphorus. And with chronic kidney disease or dialysis, you're unable to do that. So your phosphorus levels would rise. And so as a result, you're given these binders so that the foods that you take in will then be bound by, and so the phosphorus binders act like a sponge. And so it absorbs the phosphorus that is already in your body to help get rid of it. And so for you, it's a struggle. For many patients, it's a struggle keeping that phosphorus down because we know that phosphorus interferes with the calcium, and with high phosphorus levels, your body is going to try to suck the calcium out of your bones, lead to bone disease, which then leads to brittle bones. And it leads to, with that peripheral calcium, it can cause calcium deposition in your blood vessels. And one of the things we see with patients who are listed for transplant is really keeping that phosphorus down and seeing the changes that occur in their blood vessels, leading to real hard plaque disease and more calcium in their blood vessels. So it makes it really difficult. So I'm going to go with you, Kiana. You could tell us your experience with your phosphorus issues and how you dealt with it.
Okay. I didn't start phosphorus issues until like a year and a half into the dialysis. So I didn't have to take binders a whole year in until I took them. Now, I have another story where I've had a gastric sleeve done, and the binders do not agree with my stomach, or I'd like to call it my new stomach. So it's a battle between eating and taking the binders, because the binders, they fill up my stomach to the point where I can't eat. So I'm always balancing back and forth. And I could, 1 month it could be low, 1 month it could be high, it could be right on point. So I don't know what's making it, the difference besides of what I'm eating. I could completely stop and lower everything that that I eat to make it go lower with the binders. And I don't know, the balance in my body is way off. But what I've discovered after being 8 years on dialysis with my phosphorus going back and forth like that, I have developed a calcification in my vessels, and they can't even transplant me because it's just all over my body. So yeah, it's a bummer, but I'm still trying to work on some kind of system or something different maybe that can help my phosphorus, because it's not easy. They take my blood twice a month just to see how it's fluctuating, and it's something that's so confusing to me because I am taking them on a regular basis, but it doesn't appear that the binders that I am taking are working anymore. So I'm moving on to the next. My doctor actually this week suggested that I start taking Tums, and we're going to see how that works at the end of the month. So just a process besides watching your diet. And we all know how hard watching your diet is.
Yeah, and that's very important to understand is that when the high phosphorus uh, with the exchange of sucking that calcium out of your bones is going to cause that calcium to deposit in various areas throughout your body. And not only can it accumulate in your blood vessels, it can also accumulate in various tissues and many, and some can cause calciphylaxis, as someone wrote in the chat. And so you get these depositions that lead to that actually can ruin your blood vessels. And so for many people, especially if they're diabetic, it can really impact and have in terms of their lower extremities, in terms of decreasing the blood flow, not having good blood flow that then leads to significant peripheral vascular disease. And so definitely is crucial to be able to understand that this is something that will often make it difficult, because once that calcium develops in your blood vessels, and so many times I've tried to transplant a patient, and those blood vessels are as hard as rock. It's unable to chisel through that calcium that deposits in the blood vessels. And so I'm going to go to Andrew to tell us about your experience with high phosphorus while on dialysis.
Yep. Well, I've been on dialysis for about 19 years now, a little over 19 years. And I kind of like Kiana at the beginning. It didn't, I never had any problem controlling it. In fact, most of the time I would go in and my nurse would say it was actually low. So I didn't really think that much of it at that time, but as I've progressed over the years, it's gradually just gone higher and higher, and it can cause itching and uh, as both Kiana and the doctor have said, the calcification. Um, it really is just a struggle to not only find the right medications, because there are a few different types of medications, or like Kiana said, some do use Tums. So
Mhm.
it's finding the right combination, the right amount, eating the right amount of foods. It is a struggle every day.
Absolutely. And what has worked for you? Have you been on binders?
I have been on binders pretty much the entire time I've been on dialysis once it started going up. I've been on practically every one you can think of: Renvela, Velphoro, calcium acetate, all of them. Recently, we started using Exfosa, which is actually a phosphorus blocker. It works a little different. You take it only twice a day in addition to your binders, and it does seem to be helping some.
Okay. The question is, certainly the goal is really about preventing the damage that occurs with phosphorus. And oftentimes it takes a little while to appear, knowing that there is, while the dialysis, it does take out some phosphorus, it doesn't really bring it down, and which is why you need binders. And it also is, and both of you know that it's really about looking at the type of foods that you're eating. Is there any way to prevent the high phosphorus by really working with a dietitian and learning about how you can eliminate those foods. And even oftentimes you have to remember, I'm sure both of you understand that every time you eat, you have to take that binder. And because so many foods may have phosphorus that you may not recognize, um, that when you eat, even if it's a small amount of food, you take that binder because then it you have to take the binder before you eat so that it can really absorb the phosphorus out of the things that you're eating. So it's about, it really is due diligence, because once you develop significant calcium depositions, and I often will pull up the CT scan for patients for them to see that you don't actually need contrast. You can just do, it's almost as if the blood vessels in your body become recognizable like the bones in your blood in your body. So there's so much calcium that your blood vessels become outlined with linear deposition of calcium, almost as if they're similar to what you see in your bones. And once that gets deposited, you have to remember that deposition becomes very thick, almost as if it's 3 or 4 times the thickness, I would say probably about 10 times the thickness of an eggshell, which is then really hard and then unable to um, divide. And so when you think about getting into that blood vessel, you think about the debris or the dust and the small particles that may be dispensed once you get into the blood vessel. It may cause blood clots down further in the blood vessel. The blood vessel may not be open enough to have adequate blood flow, and those are the issues that we then have to deal with in terms of can this blood vessel that is now narrowed, full of calcium, um, can it deliver enough blood to the kidney, and sometimes it doesn't. And so it's many programs will say that once your blood vessels become so damaged, you're not a candidate for transplant. Someone had asked why is that an issue? So it is important to understand that this becomes something that needs to be monitored. And certainly if a patient is coming to dialysis and their phosphorus is 8 or 9, they're not even going to be considered until we get that phosphorus down to a normal level, and working with your dietitian to eliminate those foods, or since it's the binders that work, to really figure out how to keep that level down to normal. So thank you very much for your experience. And so, Andrew, what would you say has been your experience with taking this new phosphorus medication?
I think it really does help. I like the fact that I just take it at morning and at bedtime, and then it just kind of helps out with the binders as well.
So you are also taking the binders at the same time?
Yes, yes, with my meals.
Okay, so you take your binders at the meals, and have you seen what is the difference in your phosphorus levels since you've been taking the binders along with this medication?
I know last month it went from almost 9 down to 5.1, which is in the normal range.
Okay, so you've had a remarkable improvement with this medicine. And can you, um, would you say were there any side effects of this phosphorus blocker?
You will have looser bowel movements, so it's you need to be careful about when you take it. I would not ever recommend taking it right before a dialysis treatment because it will make you need to get up and use the restroom. But other
Okay, that's a
than
good
that,
point to remember that you don't want to do. So it's important to understand that the new medication may be out there, and this may be phosphorus blockers, but you have to not all. And I don't know whether is your insurance paying for this medication, or do you have to pay for it out of pocket?
Uh, my Part C, Medicare Part C is paying for, or Part D, I'm sorry, is paying for it. The copay, I believe, was something about $15. So not bad. The one thing I do have to caution you on is there's only 1 or 2 pharmacies that can prescribe it right now. So your doctor will have to send it to a specialty pharmacy.
Yeah. And that's important to know because you may not be in an area. One, it has to be prescribed. And it's probably, there are probably criteria for doing that before your nephrologist may be willing to go that route. In that one, the goal is trying to figure out how we can eliminate your phosphorus and bring your phosphorus levels down to normal. So you want to be able to say, can you maximize on the phosphorus binders? And is there a way to use them in combination with your food? Are you taking them before you eat? Can you have eaten small portions and take them more often? We know that the phosphorus binders make you constipated oftentimes. And so it's a balance. And so the issue will come as to whether your nephrologist is willing to consider alternatives if your phosphorus remains high and out of whack. Second thing also is it causing calciphylaxis? Are you diabetic with peripheral vascular disease, which can be worsened by having these blood changes occurring in your blood vessels? And secondly, is it covered by your insurance to consider alternatives if your binders are not working? Remember, the goal is to be able to get to a place where your levels are normal and you're not having that calcium exchange by depleting calcium out of your bones, which then leads to more brittle bones, potential for more fractures and bone disease, which is also another complication. When you get calcium abnormality, you're going to get into parathyroid issues and the whole 9 years. So that becomes important to understand, but it has to be prescribed by your nephrologist from that standpoint. And it may be in some cases only for those who may not have been able to achieve appropriate decrease in their phosphorus by conventional phosphorus binders methods. So certainly you want to talk to your healthcare team, whether it's your physician, whether it's a nurse practitioner that's coming through. They would also be the ones to know best what you need to do to be able to effectively lower your phosphorus level. Uh, Question, I'm on 3 phosphorus binder capsules per meal. At what point during the meal do you take them? All at one time in the beginning? So what are your thoughts, Kiana?
Well, my doctor actually told me I should be taking them right before I eat. And he had me up to 3 binders before I eat
Right.
each meal. And like I said, with me, if I take the 3 binders, I definitely can't eat right away. I would almost have to wait 15,
Yeah,
20
and that's
minutes or so
because you have
to
that
eat.
stomach
Exactly.
reduction,
So
so you don't have enough space. So the question
to
is,
even have a
right,
meal.
right,
And it definitely, when I need to keep my protein up and I'm trying to eat meat or steak, stuff like that, it just isn't any room for it. So uh, I,
yeah,
I battle between taking them and don't. So I might go 2 weeks and take them, and I might not have as much to eat. And they're like, "Oh, you're losing weight." Well, yeah, that's happening because I can't eat. But then when I stop taking the binders and I eat, I get the weight back up, and all my other levels are perfect. So
yeah.
yeah,
Your
it's been.
scenario is that, yeah, you have a small stomach, so taking 1 or 2 with a small meal or small amount of small meal may be more beneficial. He's thinking that you have a normal stomach and need to take 3 with each meal. But if your stomach is reduced in size, then your meal is going to be reduced in size. So you want to proportion that binders, and so you can take it every time, but maybe in a smaller dose. That would be my recommendation. But
Okay.
certainly you want to have the binders in your stomach so that they can, because they act like a sponge to absorb the phosphorus. So it's certainly important to take them before. Andrew, would you agree, or do you have what is your recommendation?
Usually I'm on 3 to 4 as well. Usually what I'll do is I'll take the majority of them right before I eat, and then
Right.
I might save one for about halfway through my meal, just to kind of
Oh,
get the back end.
Right. And it all depends on the size of your meal. If you're eating a whole lot, then you want to have them there for the big load from that standpoint. Well, question was, what's the difference between binder and a blocker? And so when you think about the binder, is that is you're taking in food. And so the goal of the binder is that it's going to help prevent absorption of phosphorus from the food that you're eating and block it from and keep it from getting into your blood tissues. So the binders you take with every meal and before you eat so that they're there and they can soak up the phosphorus in your stomach before it gets dissipated into the rest of your body. Blockers are worked a sort of a different way, and so your goal really is that the the phosphorus blockers help to remove excess phosphorus from the food, uh, that you're eating before it gets into the rest of the body. So it's almost acts as a roadblock uh, from get in your bloodstream. So it's a blocker as opposed to a binder. It's not soaking it up. It's just blocking it from getting into your bloodstream from your GI tract. So definitely two different mechanisms. Again, you want to talk to your doctor about whether or not this is what you need, or whether you just need to think about how you're taking your binder, change the way you're taking your binder. And even when you snack, it may be to your advantage to, even if it's with a small snack, snacking, you may take a binder as opposed to thinking of it as a meal. So if you're eating more, especially if you have gastric sleeve or any kind of situation where you can't eat a lot of food and you want to take that protein, then you still want to be able to take that binder, because ultimately you don't want that deposition to be of such that you lose peripheral, lose your leg over calciphylaxis and other issues that become a problem with blood flow. Because once those blood vessels get calcified, then you're going to have more and more decreased blood flow to that portion of your extremity, or that portion where this calciphylaxis is building up, which then leads to vascular disease and compromise of the tissues, which then lead for many people, it may be amputations of the toe, of half the foot, those sort of things. So it becomes really crucial to know what it is you need to do, whether it's maximizing the use of your binders, using them correctly, and still trying to use them even if you're eating small portions, along with working with your dietitian to really gain effectiveness of what you can eliminate from your diet. Any other questions? Let me check the chat here. Thank you, Yolanda. Well, this is Dialysis Patient Citizens, and we are having this conversation about phosphorus and phosphorus binders. And thank you for joining us. If you are not a member of Dialysis Patient Citizens, please go ahead and follow us, sign up on the website. We have a wealth of information on dialysispatients.org to tell you about what it is, great recipes for the summer. You hear from our advocates, our ambassadors, patient ambassadors. There's information about chronic kidney disease. There's information about dialysis. There's information about transplantation, how to best navigate those spaces. So thank you for joining, and we invite you to become regular members of our organization and join us every for these events on Instagram. So I appreciate all the questions, and just wanted to know, is there any other questions, anything that you want to add, Andrew?
I think one of the biggest challenges that a lot of patients have in controlling their phosphorus is remembering to take them with you, especially if you're going out, you're working, you're doing things like that, because unfortunately, most of the phosphorus binders are large pills. So they don't just easily go in a pocket or something like that. So I think that's where most patients really struggle. And
Mhm.
it's a challenge to make sure you have those binders with you all the time and you're taking them. I think that's the biggest thing.
I agree.
Absolutely, absolutely. Maybe we should design some little pocket phosphorus with a hook that you hook to your cell phone or something, because we know we take our cell phones with us all the time. But if
Exactly.
we have something that we can attach, and maybe you pick up your phone, you take up your binders, or you keep them in your carrier, whether you're a man and you have a pouch, or whether you're a woman you have a bag. Find a little container, a little lock and lock, a Tupperware container where you have your binders that could stay in your car. I don't think they disintegrate in the heat, but any method of remembering that they're there in your purse. Just as we think about our medicines and the medicines that you need to take when you're out, I always tell patients, make sure you have a reserve of your medicines with you everywhere you go. You don't know when you're going to get stuck, whether you're going to something has happened and you're not going to make it home in time for those evening blood pressure medicines or whatever you may take. to always have an extra, a few doses with you somewhere on your being or in your travel container, because it becomes important. We go out to eat or we stop to pick up some food, and you think hindsight, oh, I didn't bring my binder. So great tip. I really appreciate you reminding us about that. And not just about phosphorus, it's about so many other things that we forget to take with us when we go out. So thank you so much. And Kiana, any suggestions or tips from you, having been on dialysis for so many years?
Well, I guess the biggest thing is try your best to adhere to a diet that's less than phosphorus, because once you get up there and it's high, it's really hard to knock it down instantly, you know? And then you start becoming, it'll become a habit, you know, where you know, I can't eat all this stuff here, but I can eat this.
Mm-hmm.
Or you'll go to exactly what you know you can eat.
Absolutely, absolutely. And you know, your dietitian or generally your dialysis unit can give you a list of foods that are high in phosphorus, things that you should avoid. And many people know that. Oftentimes, you know, we all cheat every now and then, especially when we know that this is something I should not be taken. And certainly, thus becomes you get used to. It's almost everything that we do. You develop a pattern for those things that you need to avoid, because you like salt. You know that if you take a lot of salt, it's bad for your blood pressure. High phosphorus can also raise your blood pressure, because now what happens, your blood vessels are narrowed because of the calcium and the phosphorus crystals that build up in that. So that's not only going to lead to heart disease issues, but it's also going to lead to high blood pressure. So you want to, and then you make your bones brittle, so you end up not being able to do things. You end up with bone disease, hip problems, leg problems. So think about the consequences down the line, and uh, definitely with the ability to go online and look at things to foods that are high in phosphorus. You want to avoid your common foods. And even in the summer now, you know, hot dogs are a thing, powdered lemonade, all those things are high in phosphorus. We want to stop and ranch dressing. We eat a salad, but we do ranch dressing, suddenly you're adding more phosphorus. Fast foods, you know, you certainly want to avoid those kind of things. So, and I know it's easy to go to the store and buy lunch meat, but be careful with those kind of things, because those are also uh, have added phosphorus in them and therefore can really add. So think about how you can do better with your diet, because in the end, it's remember, a lot of foods have added phosphorus in them, and it's important to read your labels. So not only are you thinking about what how much salt is in there or how much cholesterol is in there, but you want to think about the foods you're eating. Do a little research about how much phosphorus is in your food, and begin to pay attention to the added phosphorus, because over time it becomes difficult. Like Hannah said, once starts getting once it deposits in your blood vessels, you can't reverse that. All you can do is slow down the process down the line, because you can't cut it out and you can't remove it. And then once you're not a candidate, even if you go from center to center, they're not going the risk is too high, because you can hear me knocking. That's like your blood vessels become rock hard and you're unable to do it. So this has been a great conversation. Thank you so much, Andrew, as president of the board of directors. I thank you for your time in coming on and sharing your information with us. And thank you, Kiana, who's also a board member, for sharing your experience with us, and for all of you who have stayed on and listened to us. We want to invite you to join DPC and go online and sign up. She also posts a number on there. Join us as a patient ambassador, and go to the website dialysispatients.org. So have a wonderful day. Stay cool, and don't be out in the heat unless you really need to. And make sure you wear your sunblock and avoid those foods that are high in phosphorus. I know this hot dogs are good, but they're not so good in the end. So Thank you so much, everybody. Have a great day.
Have a great day, everyone.
Thank you for being here.